So that's my actual talk, and then I will now continue with the case discussions. The first case is a female patient of 58 years of age who was admitted to the ICU because of an abdominal sepsis. And she was also treated with continuous renal replacement therapy with regional citrate anticoagulation because of acute kidney injury with severe refractory metabolic acidosis. And after 36 hours of CRT treatment, her total calcium value is 2.4 millimoles per liter, and the ionized calcium level is 0.8 millimoles per liter. So the question to you as an audience is whether or not this patient has citrate accumulation. Okay, I see the results right now. 76 people say yes, 22 say no, and 2 say not sure. I think these are percentages, but most people say yes, and that's actually right, because yeah, it's actually quite simple. The calcium ratio is 2.4 divided by 0.8, so that makes it 3, which is higher than 2.5. So we need to adjust the treatment, and maybe we need to stop citrate anticoagulation, otherwise we can maybe use a lower dose. Okay, so then we move on to the next patient, which is a male patient of 61 years of age, who was admitted to our ICU because of a neutropenic sepsis after a stem cell transplant 2 days earlier. And he also developed acute kidney injury with metabolic acidosis and also receives continuous renal replacement therapy with regional citrate anticoagulation. And well, his laboratory results after 6 hours of CRT treatment are, among others, a bicarbonate level of 14, a lactate level of 8, a sodium level of 135, a chloride level of 106, and a total calcium value of 2.2, and an ionized calcium value of 1.1, and the albumin level is 20 grams per liter. And then again, the same question, does this patient have citrate accumulation? So to make it a little bit easier, I've written down the NNGAP formula on the slide. And because the upper end of the normal range of an NNGAP may vary between different hospitals, I'll tell you that in our hospital, the upper end of normal for the NNGAP is 12. And we see an NNGAP above 16 as suggestive for citrate accumulation. So 71% of the audience says no citrate accumulation, and 29% says yes. Well, the actual answer is indeed that the laboratory results do not indicate citrate accumulation. Because well, the calcium ratio is just normal, and the NNGAP is increased because it's 20. But yeah, you need to correct this NNGAP for the increased lactate level, and the lactate level was 8, so the final NNGAP is 12. So there are no signs of citrate accumulation. So most of you had the correct answer. Well, then we move on to the last case. Which is a male patient of 48 years of age, who was also admitted to our ICU post liver transplant. And because he had acute kidney injury, he also was treated with continuous renal replacement therapy with regional citrate anticoagulation. And this morning, his laboratory results showed during a longer time CRT treatment a creatinine level of 80, a urea level of 7, a total calcium of 2, and an albumin level of 28. And now it's late in the evening, 11:30. He has a bicarbonate level of 13, a lactate level of 5, a sodium level of 135, a chloride level of 105, and an ionized calcium level of 0.9 millimoles per liter. And then again, the same question, does this patient have citrate accumulation, yes or no? Okay, so 68% of you says yes, the patient has citrate accumulation, 27% of you says no, no citrate accumulation, and 5% is actually not sure. Well, I myself am also not sure whether or not this patient has citrate accumulation. Of course, our pruritic chance is rather high, but based on the values, because, well, the NE gap is once again 20, and corrected for the lactate level, it's 15, so it's increased, but not that much. And about the calcium ratio, well, actually, the calcium ratio cannot be determined due to the absence of a recent total calcium. So, because when you calculate, oh, I see some things going on in the chat. Okay, but I'll first continue with the answer. Well, when you calculate the calcium ratio with an old total calcium, this may falsely result in a normal ratio. Because this morning the total calcium value was 2 and the ionized calcium value was 0.9, which will result in a ratio of 2.2. And well, but in the meantime, calcium citrate complexes might have formed, which you miss when you not determine a new total calcium value. Because at 11:30, the total calcium value is actually 2.4 right now, and when you divide that by the actual ionized calcium level, you find a ratio of 2.7, which indeed leads to the conclusion that this patient indeed has citrate accumulation.